It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. Today's subject is, what is a cellulitis infection?
What is cellulitis? Cellulitis is a bacterial infection of your skin and the tissues beneath. It most commonly affects the lower part of your body, including your legs, feet and toes. However, it can also appear on your face, arms, hands and fingers. Anyone can get cellulitis. However, you may be more likely to get it if you're a child. You have a wound such as a cut, ulcer, bug bite, animal bite, surgical incision, tattoo or piercing. You have a chronic skin condition such as athlete's foot, eczema or psoriasis. You have chickenpox or shingles. You have a weakened immune system. You are obese. Cellulitis is very common. There are more than 14 million cases of cellulitis in the United States per year. Cellulitis causes swelling and pain. If you have it on your hands or feet, it may be challenging to close your hands or walk. A cellulitis infection may cause flu-like symptoms, including a fever higher than 100 degrees Fahrenheit, 38 degrees Celsius, chills, sweats, body aches and fatigue. Symptoms of cellulitis may include pain, tenderness, edema or swelling, warmth, discoloration, red, purple or slightly darker than your usual skin color, that may look like a rash. Fluid-filled blisters. Skin surface looks lumpy or pitted, like an orange skin. Fever, chills, fatigue. Many different bacteria can cause cellulitis. However, Streptococcus, strep, and Staphylococcus, staph, cause most cases of cellulitis. Cellulitis usually appears around damaged skin, but it also occurs in areas of your skin with poor hygiene. When you first get cellulitis, your skin looks slightly discolored. It may feel slightly warm to the touch. As the infection spreads, the discoloration gets darker as your skin swells and becomes tender. Cellulitis isn't usually contagious. Though rare, you may be able to contract cellulitis if you have an open wound and have skin-to-skin contact with an infected person's open wound. To diagnose cellulitis, your healthcare provider will ask about your symptoms and perform a physical examination of the affected area. In most cases, your healthcare provider won't conduct any tests. However, if you've got a severe case of cellulitis, your healthcare provider may recommend tests to make sure the infection hasn't spread to other parts of your body. These tests may include blood test. A blood test will confirm whether the cellulitis infection has spread to your blood. Skin test. A skin test will identify the type of bacteria responsible for your cellulitis, which helps your healthcare provider prescribe the most appropriate antibiotic. Bacterial culture. A bacterial culture will identify the type of bacteria responsible for your cellulitis. Your healthcare provider will typically prescribe antibiotics taken by mouth to treat your cellulitis. Oral antibiotics may include dicloxacillin or cephalexin. Severe cases of cellulitis may not respond to oral antibiotics. You may require hospitalization and IV antibiotics. Your healthcare provider will use a small needle and tube to deliver the antibiotics directly into a vein. The fastest way to get rid of cellulitis is to take your full course of antibiotics. Some home treatments may help speed up the healing process. Home treatments include warm compress. Apply a warm compress to your affected area to help reduce swelling and other symptoms. Elevation. Elevating your affected area helps lower the blood pressure in the area's blood vessels and improve blood flow. Compression. Compression wraps or stockings help reduce swelling and improve blood flow. Don't wrap your affected area too tightly. This can cut off circulation. Remove the compression wrap or stocking at least twice every day for 10 to 15 minutes. Non-steroidal anti-inflammatory drugs, NSAIDs. Over-the-counter NSAIDs, such as aspirin, ibuprofen and naproxen, reduce pain and inflammation. Not everyone can take NSAIDs, so it's a good idea to check with your healthcare provider before use. In most cases, you should feel better within 7 to 10 days after you start taking antibiotics. You'll notice signs that your cellulitis infection is healing a few days after starting them. Your pain will decrease, swelling will go down, and any discoloration will begin to fade. You can reduce your risk of developing cellulitis by cleaning your wounds or sores with antibacterial soap and water, applying an antibiotic ointment on your wounds or sores, covering your wounds or sores with a bandage to prevent dirt or bacteria from entering the area, refraining from touching or rubbing your affected areas, getting medical attention right away for any deep cuts or puncture wounds. With early diagnosis and treatment, the outlook for people with cellulitis is good. Most people feel better after 7 to 10 days. It's very important to take cellulitis seriously and get treatment right away. Cellulitis can quickly progress and lead to more severe conditions. The bacteria could spread to your bloodstream, bacteremia, or heart, endocarditis, which may be fatal. Follow your healthcare provider's instructions. It's important to finish your full course of antibiotics, even if you start to feel better. If you don't finish your full course of medicine, your cellulitis may come back and be more challenging to treat. Refrain from touching the affected area. If you must touch the affected area, wash your hands before and after touching it. Don't squeeze or puncture the area. Squeezing and puncturing won't drain any swelling or provide relief. Rest. It's a good idea to avoid any activities that may aggravate your affected areas, including walking, running, or other exercises. Call your healthcare provider if you notice an increase in swelling, discoloration, or pain. Your symptoms don't go away a few days after starting antibiotics. Your cellulitis infection spreads to surrounding areas of your body. What questions should you ask your healthcare provider? How do you know that I have cellulitis? If I don't have cellulitis, what other condition might I have? How did I get cellulitis? What bacteria caused my cellulitis? For how long and at what times of the day should I take my medication? How should I store my medication? When will I start to feel better? Do I need to schedule a follow-up visit? What activities should I avoid? Which OTC pain relievers do you recommend? Many people who get cellulitis again usually have skin conditions that don't go away without treatment, such as athlete's foot or impetigo. Poorly controlled diabetes may also contribute to repeat instances of cellulitis. Approximately 33% of all people who have cellulitis get it again.
Thanks, David, and I want to thank you, the listener, for being here. Without you, we wouldn't be here. And I want to apologize. I wasn't here for the last 7 days, and that's because of cellulitis. I got a cellulitis infection in my right leg because of a chronic wound in my right foot. I'm back, and the apple fritters are back, and I hope you're back. So I want to thank you for being here today, and I want to remind you, an apple fritter comes out every day at 4 a.m. Be here. We're here, and I hope you'll be here. And I want to remind you, things could always be worse. That's right, my friends. Things could always be worse. Right now, there's somebody somewhere wishing that they were in your position, so things can always be worse. Hey, do yourself a favor. Make yourself feel good today. Be the reason somebody smiles. That's right. It'll make you feel good. It'll make someone else feel good. You've been listening to an apple fritter, and we're going to be back tomorrow. 4 a.m. We'll be back tomorrow. So have a great day today, my friends. My name is Jimmy Apple, and I'll talk to you again.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.